Good morning and welcome. I'm Liz Ernst, a state director for Protect Our Care Georgia. Last week, the Centers for Medicaid and Medicare released the final ACA Marketplace 2020 Open Enrollment Period Report, which shows enrollments in the marketplace have hit a record high in Georgia and across the nation, a clear policy victory for the Biden administration and Democrats. Georgia saw a 36% increase in enrollments from 2021, which is 15% higher than the national average. Georgia had the second highest enrollment increase in the nation. The surge in numbers came in part through enhanced financial assistance for enrollment, a wider window for people to sign up for coverage, and the concerns that kept healthcare coverage top of mind for people in the pandemic. Today, we're joined by leaders and advocates on the ground to discuss more about these record-breaking enrollment numbers, what it means for Georgians, and why the Senate needs to pass the healthcare measures in the Build Back Better Act. First up, I'd like to introduce Treylin Cooley, who is a healthcare navigator with Georgians for a Healthy Future. Welcome, Treylin.
Good morning, Liz. Thanks for having me. And good morning, panel. As she stated, my name is Treylin Cooley. I'm a health navigator for Georgians for a Healthy Future. And the purpose of my job is to assist Georgians with finding affordable healthcare plans, specifically through the marketplace. And because of, as Liz stated before, the increased enrollment period, in addition to some of the other subsidiaries that have now been added for individuals to take advantage of, it has made it easier for individuals to now be covered under the marketplace. Through our experience with helping individuals, it seems as if many individuals have been very reluctant to explore insurance options through the marketplace. But because of my role and really working with individuals to educate them on the benefits of receiving the insurance, we had an increased enrollment, as you guys can see, which is great for us. Still, we need more individuals to be covered within Georgia. So having this bill passed, it will mean so much for our Georgians who need to be covered. Even though the plans are affordable, they can still become a little more affordable for individuals. And with the tax credits, they have been extremely helpful to individuals to receive the financial assistance they need for the insurance coverage. But we still need plans like this in order to continue to keep people motivated and encouraged to get insurance coverage. Talking with individuals, I've learned that so many Georgians were uninsured, so we were happy to see the increased number of individuals who were insured this year, and we hope that we continue to see an increase as the years come by. But we must have bills like this in order for individuals to feel supported by the government and feel like they have some options to be able to pay for their insurance premiums. And I am here to ensure that we can help individuals navigate through that process and get the coverage that they need.
Great, thank you so much, Treylin. Next, I'd like to welcome State Senator Nan Orrock, who represents the 36th Senate District and who sits on the Senate Health and Human Services Committee. Welcome, Nan.
Well, thank you so much. And thanks to all who are joining us today. I'm really pleased to be here with our Congressman Hank Johnson. And we're here standing up for Georgians and lifting up the need nationally for us to do the right thing on healthcare coverage. And, you know, it's an exciting time. We had the Affordable Care Act in place. And then with the American Rescue Plan's enhanced premium tax credits, 4 out of 5 eligible enrollees could find a plan for $10 or less a month. And I have members in my extended family, young people, who are still in their early years of getting their jobs and their earnings up to where they need to be. And they have been so benefited by being able to sign up for coverage through the Affordable Care Act marketplace. And we're just so pleased here in Georgia to see that over 700,000 Georgians were able to take advantage of the enhanced premium tax credits with the American Rescue Plan folded in alongside the Affordable Care Act. And these are comprehensive health plans. They're quality plans. They offer doctor visits, emergency care, preventive care, hospital care, and prescription drugs. And, you know, Democrats ran and won the elections on healthcare in 2018 and 2020. And now, and on the promise to bring down drug prices, to expand coverage, and to improve care, and to lower health insurance costs, vitally needed in this era, this time of pandemic. And, you know, I'm just going to have to point out, don't want to be ugly about it, but less facts are facts, that every Republican in the House voted against lowering costs for everyday families when they voted against Build Back Better. What they were doing really is that they chose drug company profits over lower drug prices, and they voted against hearing benefits for seniors, and they voted against lower prices for prescription drugs. They voted to deny working families health care insurance because of where they live, and they voted to let children's health care expire. News flash, underscore, bold, big red letters. They voted to allow children's health care to expire. So the polling across the nation shows the healthcare measures in Build Back Better have overwhelmingly been supported across party lines by the voters and the citizenry all across the country. And they're some of the most unpopular elements of the Build Back Better plan. Voters from all parties support giving Medicare the power to negotiate lower prescription drug prices, to strengthen Medicare benefits, to expand coverage, to lower healthcare and health insurance premiums for people who buy coverage on their own. Very important, that whole sector of the population that's paying full price buying coverage on their own out of pocket. So here we are, we're in the third year of the COVID-19 pandemic. There's never been a more urgent time to ensure families can get the health care that they need, the healthcare that they vitally need. Can we emphasize that enough? Is there any doubt in anyone's mind now how critically important it is to have our population covered with access to healthcare through insurance plans? Democrats in Congress and the Joe Biden administration are going to continue to build on the success of the Affordable Care Act and its expansion by way of the American Rescue Plan. These are policy changes that would be made permanent by passing this element of Build Back Better. We've got to ensure healthcare is accessible to everyone who needs it. And that benefits not only the family, not only the covered individual, but the entire array of people that provide services, the hospitals, the ambulances, all of the doctors that are asked to cover people who don't, to treat people who don't have insurance. And so this is a critically important thing for our nation. And you can see already here in Georgia, when we put this coverage in through the American Rescue Plan, that our numbers went through the roof. People need this coverage. We need to pass this in Congress. And we just want to send a message today from Georgia. Listen, members of Congress, to the people in your districts who are actually in dire need of continuing these benefits, this great package in Build Back Better, which would make it permanent. Please heed the plea of your own constituents and take action to pass the Build Back Better plan. Thank you.
Thank you, Senator Orrock. And now I'd like to introduce a champion for the ACA, the American Rescue Plan and Build Back Better, Georgia's congressional man, Hank Johnson, who is serving his 7th term from the 4th District. Congressman?
Thank you so much. And actually, it's hard to think about it, but I'm actually serving in my 8th term in Congress. So this is my 16th year. And I've been very pleased to represent the citizens of Georgia's 4th Congressional District in the United States House of Representatives. And I want to thank you all for having me here today. Also want to give a big shout out to our lioness in the state Senate, Senator Nan Orrock. Georgians are so privileged to have her representation of us under the Gold Dome. Thank you, Senator. Ladies and gentlemen, greetings to everyone. Millions of Americans enrolled in coverage through the ACA marketplace before January 15th. Nearly 2.4 million people, including 184,022 new Georgia enrollees who chose health plans through healthcare.gov for this year and are new to the ACA marketplaces. This did not happen by accident, ladies and gentlemen. When we passed the American Rescue Plan without a single Republican vote in the House back in March of 2021, we did more to lower costs and expand, and expand access to healthcare than any other action since the Affordable Care Act has passed. And the American Rescue Plan made quality coverage more affordable than ever, with families saving an average of $2,400 a year on their annual premiums, and 4 out of 5 consumers finding quality coverage for under $10 a month. The net result is that millions of Americans now have access to the healthcare system. Millions of tens of thousands of Georgians now have access to the healthcare system. And now they have the security and peace of mind that dependable health insurance brings. For too long, Americans have had to pay too much to see a doctor or get the medications they depend on. They had to choose between healthcare and putting food on the table or paying the rent. Now, working families, seniors, and parents will pay less for prescription drugs and health insurance, and millions of Americans will now have a health care that they previously did not afford, they could not afford. And so, but we can't stop there, ladies and gentlemen. The ACA subsidies will expire at the end of 2022, and we need to ensure that the care that Americans are now receiving is made permanent.
That's right.
And that's why we need to pass the Build Back Better Act, which will strengthen their care and keep their costs low. The Build Back Better Act is a historic reform that levels the playing field for working people, lowering their everyday healthcare costs so that they can have a little bit of breathing room. Healthcare is the kitchen table issue in every household in America, and this plan brings down costs so people worry a little less when they go to sleep at night. The healthcare provisions in the Build Back Better Act will deliver lower costs for families struggling to make ends meet. Healthcare costs shouldn't bankrupt anyone, especially in a pandemic. As Americans, we can and should do better. It's more important than ever that the Senate pass Build Back Better. The House has already passed it. The Senate needs to pass it. We've got a couple of senators that we're still working with to get it done. I have abundant hope that we'll be able to get it done and pass Build Back Better and deliver for the American people. And with that, as we say in the House, I will yield back.
Thank you so much, Congressman Johnson. Really appreciate your remarks. That concludes our remark section. And before we open up Q&A, I'm going to turn it over to Kelly, who's going to share how questions can be asked. Kelly?
Yeah, thank you, Liz. And thank you so much to all of our speakers today and everyone who is joining us on Zoom and on Facebook Live this morning. If you are watching us on Zoom today and you have a question for the panel, please use the Q&A feature at the bottom of your screen to submit that question, and we will field those as they come in. And if you're watching us on Facebook Live this morning and you'd like to ask a question, you can leave that question as a comment on the live stream feed, and we'll be monitoring those for questions as well. So again, if you're watching us on Zoom and you'd like to ask a question, please use the Q&A box at the bottom of your screen to submit that question. And if you are watching us on Facebook Live, please just submit any questions as comments on the live stream feed. We did have one question coming in for Treylin. The question is asking if you can share a bit more about how cost impact, as you're helping folks navigate the health insurance marketplaces, what role does healthcare costs play, and how is lowering costs affecting people in your community?
I thank you for that question. Many of the insurance plan premiums for individuals through the marketplace, for some reason, are still reflecting to be extremely high or not as affordable as people would like to be. So the tax credits have helped tremendously, and just having conversations with individuals about the tax credit and knowing that there are systems put in place to assist them have caused them to be a lot more comfortable. And one of the interesting things about it is because you've had individuals who've been helped and who have also, who have also received tax credits, I think it has really impacted this surge of people who wanted to apply for marketplace insurance just based on word of mouth. Initially, I was a little reluctant or did not think that I could be helped, is what I've heard from consumers. But because of the tax credits that have been put in place to assist me and get affordable coverage, I can now tell my neighbor, I think you should check this out, or another family member who needs coverage. So having that conversation about what helps are available to make sure and ensure that you can have affordable health care, I think it has opened up the window for more people to be open to having the conversation and wanting to get insured. So that conversation has been very important. And that specific piece of assistance that's been put in place has been great from the consumer feedback that I've received.
That's great. Thank you so much for sharing that. I want to give both of our legislators and leaders from Georgia an opportunity to weigh in there too about how monthly savings on healthcare premiums actually really impact folks across the state.
Thank you so much. And again, thanks to Protect Our Care for making this live stream conversation possible on such an important topic. And Treylin Cooley, kudos to you for the work that you're doing and the agency that you work for, playing a critical role. People definitely need the navigator function, and we have had to fight in Georgia, to have a decent access to navigators. And this is it's not easy. People are busy. They're got all the balls in the air of keeping their family's head above water, working the tough jobs, tough shifts, and dealing with all the needs of their families and their children. And so having a navigator is just heaven on earth, really. Somebody that will take you and walk you through it. And I just want to give super applause to the way that you and Georgians for a Healthy Future are stepping up and filling that role. And we've also, we have had to fight in Georgia for sadly to say, we've had a governor who wants to do an alternative plan called the Georgia Way, for heaven's sakes, which would prevent all Georgians from having any access to healthcare.gov. Can you imagine? We're going to throw up a barrier to that. So thankfully, the Biden administration has said, no, hands off. That's not going to work. The Georgia Way is not the way to get people adequately insured and covered for their healthcare needs. We're here to say today, Build Back Better is the pathway to the right direction for millions and millions of American families. And it's the direction that we need to go in. It's part of the spirit of the Affordable Care Act. And here is an opportunity. And as I said, we've got people in Congress, and Congressman Johnson knows them well. You work in that tough terrain up there, Congressman, that stand in the way of lowering drug prescriptions, of getting hearing aids covered, for Lord's sakes, for seniors, getting these needs met. And this plan that the Biden administration has brought to the table, first with the American Rescue Plan, building out the coverage, lowering the cost for these great plans, so that they're so accessible now. And so many Georgians responded, and we need people to put party aside and get on board with what's in the best interest of the American people, families, children. For Lord's sake, don't let affordable healthcare coverage for children expire. How could you stand by? How could you look yourself in the mirror and do that as a member of Congress? So we're sending out a clarion call here from Georgia based on our experience. Me as a Senator Long, working on health policy and very much clued into the needs in my district, and Congressman Hank Johnson, who represents a huge swath of DeKalb County and City of Atlanta folks, keenly aware of the need as well. Pass the Build Back Better plan. That is our call to action. And get on the phone and call your member of Congress and send them that. And our senators that we have in Washington from Georgia are with us 1,000%. It is their colleagues that need to be won over. So thank all of you for participating in this effort.
Yeah, healthcare is such a very important part of living here in America. Healthcare is not just a privilege for those who can afford it. It's actually a right, and it's a responsibility of a government that is of, by, and for its people to provide a means whereby people can access the healthcare system. And so what we've done in this country, we live in a capitalist society. And so insurance companies have come into play, and they make a lot of profits by connecting workers to medical networks. And so that process has morphed into a situation where now you have the insurance companies that control the delivery of healthcare in this country. And so when under Democrats, we passed the Affordable Care Act, it was looked at by Republicans who support big business. By the way, Republicans support big business and wealthy individuals do quite well when Republicans are in office. When Democrats are in office and hold the levers of power, then working people, poor people, tend to be able to get ahead and advance in this society. That's who Democrats are attuned to, is the people. And so when we passed the Affordable Care Act, it was an evolution away from the insurance companies having a firm grip on healthcare into a situation where the medical professionals would reassume primary control over the healthcare of the patients. And so what did the Republicans do? They came out with repeal and replace. And we saw former Representative Tom Price come with a plan that was 75 pages in total, Senator Orrock, to replace the Affordable Care Act. And it was not worth the paper that it was written on, but incessantly since that time, Republicans have done everything they can do to try to kill the Affordable Care Act, including on the state level with governors like Governor Kemp and with presidents like President Trump, just throwing roadblocks in the way, cutting the time, the enrollment periods, defunding the navigators, just all kinds of tactics to try to keep people from meeting success under the Affordable Care Act. But with Joe Biden back in office, first thing that happened was passage of the American Rescue Plan, which reinvigorated the process whereby people could apply for this affordable health care insurance. And it also increased the premium support so that it made it more affordable to those people falling in the coverage cap. And then with the introduction of the Build Back Better Act, we're going to take those people who cannot afford to be in the plan, and they need Medicaid expansion. We've covered that so that they can join also the exchange and get premium support and not have to pay more than $10, $15 a month for insurance. And so that's where we are. We are standing on the cusp of being able to pass a Build Back Better bill. We will, in Congress, pass Build Back Better in some form, and I believe that it will include the coverage for those who fall into the coverage gaps that exist. And with that, people need to know that your vote is so important. You can't look at this like, okay, I didn't get everything I wanted when I elected Democrats to a 50-50 Senate, and we have a president, and we have a House where there are it's a 5-vote margin for Democrats. Everything is really slim. There's not a lot that we can do without appeasing some who are not wanting to do what we want to do, but we can advance the ball as much as possible. But it's so important that people overcome these obstacles that are being put in your way in terms of voting, and be able to get out and vote in 2022 to make a difference, so that come 2023, we will have more people to support these programs that exist to help regular, ordinary, working people, poor people trying to advance into the middle class.
Thank you so much, Congressman Johnson and Senator Orrock, and also to Treylin for all of those remarks. Liz, it looks like those were the only questions we had coming in, so I'll turn it back over to you.
Great. Well, again, thank you, Treylin. Thank you, Senator Orrock and Congressman Johnson, for taking the time today. As you guys all noted, as the nation recovers from the pandemic and economic crisis, there has never been a more critical time to provide lasting relief for American families. And Georgia's high enrollment numbers in the marketplace are a testament to the program's success and the need for more access to healthcare. President Biden and the Democrats in Congress have worked hard to lower healthcare and prescription drug costs for Georgians. Now it's more important than ever that the Senate pass the Build Back Better legislation. Again, thank you to all of our speakers, and thank you to all who have joined us today. Be well and stay safe. Goodbye.